Plastic surgery used to be reserved for celebrities and very hush-hush. But as more of us look into getting procedures, less invasive and natural results are what everyone is looking for. And we have plastic surgeon Dr. Kamakshi Zeidler, or Dr. Z as she's known, here today to talk to us about new ways to achieve results with Alloclae. Hello, Dr. Z.
Hello.
Dr. Z, can you tell us about Alloclae?
Yes, Alloclae really is the first off-the-shelf fat solution that can be used for body contouring. And just like you were saying, for achieving natural results that can be long-lasting, as plastic surgeons, we're really excited to finally have a product like this.
How is it different from other fat transfer procedures?
Yeah, so as a kind of lifelong fat grafter, those procedures require usually general anesthesia, liposuction of a region of the body, say the love handle region, the abdomen, the inner outer thighs, anywhere where there's pinchable fat, and then the fat can be processed in various ways and then re-injected to areas like the breasts or the buttocks, hips for contouring. We even use it in the face. And so this is kind of an involved process that requires multiple regions of the body, not just where you want to put it, but also where you want to take it from. Very different from this new option, which basically fat can come in a syringe off the shelf and be injected in the office, just under local procedure where patients drive themselves to the appointments, oftentimes drive themselves home.
I didn't realize that the downtime was so minimal. So what kinds of procedures use Alloclae and what can't you do with it?
Right. So, as physicians, we're very familiar with ways to use products that are both FDA approved, FDA not approved, but cleared. And then what many of us do with our expertise is off-label. So Alloclae is a product that has been FDA cleared for replacing volume loss where fat naturally exists. So it's a product that's derived from human fat, and therefore it's indicated for replacing where fat exists. So subcutaneous fat anywhere in the body. And many of us in surgery, particularly plastic surgery, we're a field of innovators, are using it off-label. So within our area of expertise and comfort zone to treat other areas, such as the breast and deeper tissues.
Can we take a step back to explain the difference between FDA approved and FDA cleared and off-label? It can be kind of confusing.
Yeah, I'll kind of simplify it. So when a new product comes to market, they're, anything from breast implants to these sorts of, fillers, they go through a process of being vetted by the FDA, and the FDA will give its stamp of approval for a certain indication. And Alloclae is one of those that has the use of being able to be injected anywhere where fat naturally exists. So fat exists all over the body. We have a layer of it under our skin everywhere, and then deeper pockets and other regions. Now, within this framework, we as physicians, particularly plastic surgeons, can use certain products off-label. An example of this is, say, like breast implants, which are indicated for women over a certain age. Well, we may decide that under a certain age is basically the same thing, and we can do something off-label in our best judgment. And sometimes there are products like this. For example, Botox is another one, which is FDA cleared for regions like the forehead, the crow's feet, and most recently the neck. But we sometimes use it to inject little muscles in other parts of the face. So very comfortable within the same framework, but a slightly nuanced, different use, if that makes sense.
Absolutely. And how do we go about consulting someone who may want a fat transfer procedure?
Let's just say there's a patient who comes in and say, I see a couple of categories of patients. Someone who wants their hips contoured in such a way that the hip dips are a fixation now, wearing the cute workout pants and the little dip on the side of the hips is something that a lot of patients are wanting to round out. So when I see patients for this, there are a few options. I mean, one is surgical. So we can do classic fat transfer, which requires liposuction. In those cases, we often take a little away from the lower back, the inner outer thighs. So we're contouring the region around the buttocks, and then the fat can be re-injected. And this is a surgical procedure. And some patients really love this option. They want some liposuction anyway. And so that can be a great option. For some patients, they really just want to get in, get out, get right back to working out and want an immediate result, but not have to go through anesthesia and recovery and garments and downtime and waiting for an eventual result. And sometimes they want to be able to build incrementally. And so that's where Alloclae fits in to achieve similar types of results with a similar sort of product, but rather than their own fat, it's cadaveric fat or other people's fat. In some way, it sounds kind of creepy, but in a way, it's like dead people's fat, the fat that is then processed and treated to remove the DNA and all of the cellular content, and then that can be packaged up, delivered to us, and in a way that we can inject it right in the office. So someone would come in, we would apply a little topical numbing, I would inject the area to keep it comfortable, and then clean it and inject it in an office-based setting. And patients can pop up, really see the results right away, and oftentimes be able to drive themselves home, or certainly, get back to their regular life within a couple of days.
Okay, so again, minimal downtime. So how long do the results actually last?
So it's a good question. I mean, in medicine, we're often very scientific, and some of the results of the studies are still ongoing. And I think the jury is a little bit out on how long this will last. We have very similar products to Alloclae that provide different types of results, but are manufactured in a very similar fashion. So Fat Matrix, there's a product that's been around for over a decade called Renuva that I've used and has very good, long-lasting results. There are similar products that we use all over surgery, whether it's tendon grafts, nerve grafts, collagen matrices that come from skin derivatives. We use these in plastic surgery in particular, but all parts of surgery. And we find that the body grows into these products, and basically, this scaffolding provides a framework for the body to rebuild. So we're familiar with these products having a very long-lasting effect.
I love the way that you explained it, but unfortunately, Dr. Z, you can't be everywhere. So what should people look for if they'd like to get an Alloclae procedure and can't come to you?
Yeah, I think that Alloclae falls in the wheelhouse of any surgeon. In particular, a plastic surgeon has a lot of experience with the anatomy, and surgeons who do a lot of fat transfer will provide excellent results. So I would look for someone who has experience with fat grafting or fat transfer in particular in the area that you're interested in, because the technique and the type of results you will get will be very similar to what can be achieved with surgery. So find a fat grafting expert. I would also look for someone who has familiarity with this product in particular, so can advise you on how much to use, how to build it over time. It's not inexpensive, and so you want to make sure that your investment is worth it. And so there are many of my colleagues around the country who, like me, have taken the time to really understand the product, to participate in the research studies, and to collaborate with one another so that you as a patient get really great results.
How can people follow you and learn more?
Oh, well, that's a great question. I try and keep up with things like Instagram, blog posts, and information on our website, and so that people can see some of the before and after results and what's possible. I think that a personalized consultation is really what's necessary because everyone is unique. You never know how your unique anatomy or your medical background will affect the way that we recommend these products are used or the types of results that you would get.
Thanks so much for being on the Tech Show, Dr. Z.
Absolutely. My pleasure.